And we're back. I'm Angela Stribling, host of Pillow Talk with Angela on WHUR. I love this. We are talking about so much, giving such good information. We're Facebook live streaming, and I want to encourage you to just give us your comments, questions, whatever it is you want to say. This is all for you, so don't be shy about it. We're here for Mayor Muriel Bowser's Maternal and Infant Health Summit. This particular segment is called You've Got Options, and I've got an illustrious panel here. Why don't we start off by letting you introduce yourself and just tell us what you do.
Okay, my name is Tiara. I am a doula and a lactation consultant. I own a company called Crown and Cradle that serves just the entire DC metro area. And I'm basically just, my goal is just to serve mothers in the community. I'm also a nurse. But my main goal is just to serve mothers and just to really improve the rates of breastfeeding and safe birth outcomes.
We're going to get into all of that. I love it.
Hi, I'm Loral Patchen. I am a midwife. I'm also a public health scientist, and I'm a board-certified lactation consultant.
Okay.
I'm Tollie, Elliott, OBGYN, Chief Medical Officer of Mary Center, native Washingtonian, been here my whole life, and absolutely adore taking care of everybody here.
Adore. I love to hear that. Okay, now we're talking about you've got options. Now, the options, doulas, midwives, OBGYNs, and more. You've got lots more options than maybe you even knew about. Let's talk about breastfeeding. It's been a hot topic button lately. So many people divided on it, being important, being necessary. Can you explain why breastfeeding is so important to a child's development? Who wants to take that first?
I think breastfeeding is just important just for development, not only physically, but also emotionally, economically as well. It's very beneficial. We've read studies and seen research on how it helps with respiratory issues. It helps with healing for the parent as well. And it just also helps with just the bonding and the emotional development of the child as well. And I think it also just, again, it's good economically, it's good for the environment, and I think everybody would agree that breast milk is the safest thing for your baby.
So let's talk about being a doula and your role in the whole breastfeeding and helping mothers with that.
I always say I wear a lot of different hats in my, roles. As a doula, I'm more of a,
What is a doula?
So a doula is basically just a educated support person. I like to say. I think that's the easiest term that people will understand. My job is to mainly educate the expectant parents during pregnancy. And then once they are going through labor and delivery, it turns into more of a collaborative role with your midwife and your OBGYN. And then afterwards, once the parents come home, I assist in adjusting them with the transition. And so my role as it plays with breastfeeding mainly deals with just giving that support, because I feel like that's what most new parents need. They might have the education, but they feel like they're lacking that support.
That's good.
So as a doula, my job is just to support and give them resources. And then if we come up with any problems that may be a little bit more out of my scope of just support, I put on my lactation consultant hat, and then we kind of figure out, more
what they need to
what's
do.
going on.
As a midwife, so let's talk about your role there, and then breastfeeding, and then how you can help mothers.
So midwives, there's a couple of different kinds of midwives is one thing to be aware of. There are certified professional midwives that are trained and sort of orient their practice to out-of-hospital settings. And then there are certified midwives as well as certified nurse midwives. And certified midwives and nurse midwives have the same skill set in terms of providing the midwifery care and the management of pregnancy. And then nurse midwives have the additional credential as a nurse. So
I'm so glad you say, because you don't hear that term midwife anymore. And honestly, when you say it, it just conjures up these people you see in the movies when folks couldn't go to the hospital, they're going to have the baby at home, and you just learn to be a midwife.
Well, it's very different now. Most hospitals actually, most midwives actually deliver and assist women with birth in hospital settings. But there certainly is, nationally, there's a lot of interest in out-of-hospital settings, and there is a particular training orientation and focus to that with the Certified Professional Midwife.
So good.
But midwives are, it's a full training program, it's an advanced practice position, and one of the things that is a little different between midwives and OBGYNs is that we do actually have lactation as a core skill set, and it's incorporated as part of our core competencies.
And the OBGYNs do not?
No.
It's not the first thing that we get trained in.
Yeah.
It's definitely things that we touch upon during residency and training, and also after career-wise, once you get out and continue medical education credits. But as a primary focus, the focus is on the medical side and focusing on all the surgical aspects that are entailed in
So when it
obstetrics.
comes to something like breastfeeding for your patients, is that something that you encourage
Oh, absolutely.
or just leave it to them?
Absolutely. I mean, it's definitely, it makes the most sense, as we stated economically, it makes the most sense. Medically, it's healthier for the baby. It's healthier in terms of bonding. You're dealing with mothers that might be going through a moment in their life where they're questioning whether or not they're smart enough, whether or not they're good enough, whether or not they're ready for this process. So it does promote bonding, and it definitely promotes that relationship that helps.
What would you guys say are some of the most common misperceptions about breastfeeding?
So I think one of the things to keep in mind about breastfeeding is that we tend to talk about it in terms of health benefits, which are certainly very important. And then we also have talked and mentioned bonding as sort of an emotional, psychosocial component. But one of the things to remember about breastfeeding is that it is one of the primary ways in which mothers and infants begin to connect and work as a unit. And that's one of the most important pieces about it, because infants make sense of the world and the world around them through their mothers. So if you think about even the infant's initial visual focus, it's what's right around them. And what they're oriented to is essentially being in their mother's arms and on their mothers. And so that's how they begin to understand the world. And that's also the reason why there's a lot of other kinds of benefits to breastfeeding, which are actually just about being skin to skin with their mothers and physiologically close to their mothers. So part of what we need to begin to understand around breastfeeding is that yes, it is a nutritional question and there are nutritional components to it, but it is also about treating the mother and the infant as a unit. And one of the things that we don't often appreciate fully about breastfeeding is that it does help the infant sort of complete some of its developmental and physiological maturation. For example, breast milk has components of it that really help continue and sort of complete the development of the intestinal system and the GI system, and it can set the infant up for optimal nutrition, absorption, and some of their own physiological processes. So I think the more we're able to start thinking about breastfeeding in the context of infant development as part of a continuum, the more that we begin to sort of fully appreciate the impact, not just in terms of the food that they ingest, but also in what it does for their orientation to the world and their environment.
Yeah.
I agree.
Are there resources about breastfeeding online? If people are, maybe they've heard all these different rumors. I know one of them, if you breastfeed your child, you will lose weight really quickly.
Yeah.
I don't know if that's true or not. Is it?
The evidence is actually mixed. I think most women that breastfeed will oftentimes reflect on weight loss. I think the key problem in the scientific literature is actually whether or not people are exclusively breastfeeding. And when women exclusively breastfeed, there's more benefits to them individually, one of which may be weight loss. But it does get kind of hard to tease out if people start having mixed feeding practices and things.
Right,
Yeah.
exactly.
And
And the
I-
resources
Yeah,
online.
I always say, Google is not a bad thing, but be leery of Google, be leery of Facebook groups, make sure they're backed by someone who does have a lactation knowledge. There's a site called kellymom.com that if you just go on, they have evidence-based articles regarding kellymom.com. And you can just, any question you may have for like early breastfeeding help, she has it topic by topic. And I would also say look into your community, to your doctor's office, your clinics. Most of those places do have breastfeeding support groups. And if you don't see one, that's something that you could bring up to your doctor or your provider. And I always tell my clients to try to get involved if breastfeeding is something that you want to do. There's Breastfeeding Coalitions. I know DC Breastfeeding Coalition is a great resource that they can kind of point you and direct you into other ways to get involved and get accurate information. About
Keyword accurate.
Exactly. But many facilities also have lactation consultants, and oftentimes we forget that the help might be right there. And sometimes when you advocate for your own health, they're going to come and help you out.
All right, Dr. Elliott. Now, when it comes to the OBGYN in the mother's, you know, in this whole thing, whenever you're going to have a baby, once you're pregnant, then once you have the baby, talk about your role in this mother's life.
You know, I would say that I jokingly tell my patients I'm the what if guy.
You're the what?
The what if guy.
Okay.
Birthing is a natural process, and it's my job to work together with the mother and the parents and the family in terms of navigating them through that process. Because a lot of times they come in either late to care or they come in very scared. It is.
I bet this is big.
I was frightened when when my wife was pregnant with the first child. So it's a big deal. And but as an OBGYN, we absolutely dive into the details of their health history. We dive into the details of what's going on with their home life. We look at, just as the midwives do, we look at the intimate partner violence, we look at the housing, we look at the nutrition, we look at what are you doing before you came to see me? How was your health before you engaged this process? Did you start vitamins? What was your weight? What was your nutritional setting? So as an OBGYN, we do all that, as do midwives, but the additional steps in terms of the operative vaginal deliveries, in terms of the cesarean sections, in terms of when the patient crosses that line where there's an element of risk that's involved that goes beyond the scope of what a midwife does, that's when OBGYN comes in. But we also work very closely with the midwives. So it's just as a family unit works well as a team, so does this whole collection you have up here.
Yeah, it makes a lot of sense.
One way to think about it is that, you know, as a midwife, I always consider myself to be an expert in normal obstetrics, and my physician colleagues certainly understand and, you know, are trained to deal with normal, but their real focus and their expertise that I don't have is to address complications and things that fall outside of that.
But we do like normal.
Everyone loves normal.
We want it to be normal.
Everyone loves normal. Everyone loves normal. But I will say, like, as a midwife, I think because we have the luxury of, you know, not being asked or called upon to deal with the things that are most complex and really get into the areas of pathology, we are able to bring a lens to the pregnancy that is through the expert eye of normal, and also then to be able to spend time to look at the other aspects of women's lives, which I think all of us do, and try to really incorporate a more holistic approach from having that additional time. One of the things that we do at MedStar Washington Hospital Center in our OBGYN setting is incorporate the work of social workers and sort of behavioral health assessment, and trying to take a full look at some of the things that were already mentioned, and really then try to find out, there are other things that you need and that we need to consider as part of your health care that wouldn't fall into that traditional clinical definition.
It's so good. I mean, there's so many options that are available. Okay, if you have a midwife, do you need a doula? Do you need both, or is it one or the other? Do you guys work together?
So doulas are experts in care, coping, and support. Midwives are experts in labor management and normal obstetrics. So there's certainly a lot of overlap at times, but there's definite areas of expertise. And I love it when I have a doula in the room with me, because one is I'm often called upon to sort of address the needs of multiple patients at a time, whereas a doula is working one-on-one. And then the other piece is that my attention may need to focus in on something that's very clinical, whereas the midwife and then the doula can maintain her focus on the support for the mother. And so it's a very symbiotic relationship, but I would also say that on the other end of the continuum, which is when things become very complex and really require someone with the expertise and the training of a physician, then my role becomes one of support and sort of maybe a translator at time to help mothers make that transition, so that the physician can really focus on what has occurred in that care that requires their expertise in that setting.
Ideally, you're all working in tandem.
Yes.
The person has all of this.
The biggest thing I think is that you want to make sure that the support network is there for the mother. Mothers that have the right support network generally tend to have better birth outcomes.
Agreed.
In terms of when they show up for labor and delivery, they're less likely to have a cesarean section. simply because they are able to navigate through that process. There are a lot of nuances to labor and delivery that you really can't put on paper, that manifest in the process of labor. And sometimes when a person seems as though they're on the edge of potentially getting a C-section, you may kind of dial it back a little bit and understand that you can give them a little more time. So it's definitely a nuanced experience. But I think the most important factor in all of this is that the level of support that's there for the mother makes a difference.
Yeah, that is the most important thing. I mean, and doula, I mean, this is a new term to me. Is it new, or has this term always,
I feel like
this
due
position
to
always...
social media and due to more celebrities coming out saying that they've used a doula, I think more people are starting to get familiar with them.
It's so good.
But we've always been there. We've always been there. Just think about it, back in the day when we would give birth, it would be your grandmother would be your doula. You know what I mean? So I think the roles just have changed just based off of family dynamics. But again, I feel like each person is definitely vital in the care of a birthing parent, definitely during their pregnancy.
And for mothers that, for new mothers or even experienced mothers that have never had a doula, it sometimes gets confusing, because they may go to the doula saying, will you deliver my baby, not understanding the doulas do not do the delivery. You know,
I don't want to do the delivery.
Midwife, it's the OBGYN.
She goes, let me be clear.
So it's really important, because it can get confusing if you don't understand everybody's role.
And I would say we've talked a lot about options, and as women look at their options and things, I think the one thing that everyone should try to find is what I think people are seeing here, which is communication and collaboration.
Yes.
Because you don't really know what's going to expect, and so you want to make sure that you're in an environment where you have folks that are able to have this conversation and really be participant in that continuum of care.
It should not be for the camera.
Yes.
I mean, when you're on labor and delivery, it should be just like this.
Yeah, which is so perfect. Thank you all so much for your time, your expertise. This has been great. You know, this is all for you. We're Facebook live streaming. If you've got any comments, any questions, we want to hear from you all day long. All right, we're going to take a quick break, and we'll be right back.